Hey guys, we're seeing more movement at the federal level to restrict what can and can't be purchased with SNAP benefits. And I haven't seen a lot of people talking about this one yet, so I wanted to bring it to your attention because there is still something you can do about it as long as you take action before September. So let's dive in and talk about what's going on and what you can do about it. So, as you know, the Make America Healthy Again movement has been pushing for big changes to how Americans eat. 6 states have already received approval to restrict soda and other items from SNAP purchases. Those changes will begin in January 1st of 2026 in Idaho, Indiana, Iowa, Nebraska, and Utah, and they will begin July 1st, 2026 in Arkansas. We have details on all of that in our other videos. However, what I want you to know about today is that that movement is starting to see progress at the federal level in creating more broad restrictions across the entire United States. And that is one thing that we kind of expected to see as these states were being pushed to develop these patchwork regulations. Now, of course, one of the biggest barriers to implementing some sort of broad nationwide change is the lack of consistent definition for what constitutes healthy versus unhealthy food. People just don't agree on what that means. And that's why you see so much diversity about this at the state level. For example, Arkansas's new law is going to block all fruit and vegetable drinks that have less than 50% natural juice, as well as unhealthy drinks and candy. Meanwhile, Iowa has decided to block all taxable food items except food producing plants and seeds. So their law is actually going to block granola bars, fruit leather, and snacks that people may consider healthy just because they're kind of caught in that umbrella of taxable food items. Now, that is one of the reasons why the federal government is pushing for a more unified definition of, in this case, ultra processed foods. They're saying those ultra processed foods are responsible for a lot of the major health problems that we're seeing in America today. So, the Secretary for Health and Human Services, the Food and Drug Administration, and the United States Department of Agriculture are all working together to try to come up with one cohesive federal definition for what constitutes ultra processed food. Because the reality is that there is no standard definition on what that means right now. And although this sounds very technical, I want you to know it's important because any definition that they decide on is going to be used to decide what you can buy with your SNAP benefits, as well as probably your WIC benefits, what they're going to put in school meals, and more. This is going to have some far reaching implications, and that's why it's important that you make your voice heard as we move into this process. So, here's why I think it's likely that they are going to use this definition to create these changes. We have a couple of quotes here on screen from some of those secretaries of those departments we just discussed. USDA Secretary Brooke Rollins says, "We are working to make sure our kids and families are consuming the healthiest food we produce. I look forward to continuing to work with Secretary Kennedy and other members of the Make America Healthy Again Commission to improve our nation's health." That's what the USDA secretary said. Meanwhile, Secretary Kennedy says, "Stop allowing beneficiaries of the Supplemental Nutrition Assistance Program to use their food stamps to buy soda or processed foods. 9% of all SNAP funding goes to sweetened drinks. It's nonsensical for U.S. taxpayers to spend tens of billions of dollars subsidizing junk that harms the health of low income Americans." So there's not a lot of ambiguity there. They want to curtail what you are able to buy with SNAP benefits. And that is the direction that we are seeing the states and the federal government move in. In fact, some organizations like Head Start are already moving ahead with those goals already. Head Start was just awarded new funding to upgrade their food services, improve nutrition education, and more. And in that press release that announced those changes, ACF Acting Assistant Secretary Andrew Gradison said, "Make America Healthy Again wants to protect America's most vulnerable children from frequent exposure to poisonous ultra-processed foods. Increasing access to whole foods and nutrient-dense meals while emphasizing parental nutrition education is one way that ACF is addressing the causes of chronic disease." So you can see all the different organizations across the government are all kind of coming together on this one main talking point here. So as of July 24th, they have put a comment in the Federal Register that you can leave feedback on. And what they are trying to do is get answers to some big questions about what should and shouldn't be considered an ultra processed food, and how we should fairly define that, and how it should be implemented for SNAP. So, in the background where they filed this, they said the United States faces a growing epidemic of preventable diet related chronic diseases. Improving nutrition is therefore one of the most important public health interventions for reducing chronic illnesses and premature death, and for helping make Americans healthier. So, they're saying that ultra processed food is linked to all these negative health outcomes. And they're saying that some researchers have estimated that more than half of calories consumed by adults and children in the US are from foods that the researchers classified as ultra processed. Now, of course, the complication with that is that there is no single definition of what is considered ultra processed. So, without reviewing each one of those studies and surveys and research papers independently, you're not really going to know what that last statistic even really means. The most common definition for ultra processed food comes from the NOVA system, which basically says that a food is ultra processed if it has certain ingredients or substances, or they use certain processing techniques, or even packaging to market that product. Now, of course, the problem with that is that some of their definitions also sweep up foods that are widely considered healthy and beneficial, like yogurt or whole grain products as well, just because of the broadness of that definition. So that's why some states have started taking matters into their own hands, trying to figure out how to define this. And they have proposed defining ultra processed food by what it has in it. Maybe if it has a stabilizer or a thickener or coloring or flavoring, maybe that should make it ultra processed. Other states have said, well, if it goes through certain processes like the hydrogenation of oils, then maybe that's ultra processed. And others have said, well, if it has one of these ingredients in it, then we're going to call that processed. But because we're starting to see these patchwork changes emerge, the federal government wants one solid, uniform definition that all of the states can use. And that's why they want your opinion. They are seeking public comment on the matter until September 23rd of this year. So you have some time to put your thoughts together and to submit them at the Federal Register. I'll drop the specific link below, but basically they're asking a whole bunch of long and complex questions. But what they boil down to is this: how should the government decide what counts as ultra processed? Which ingredients should count as ultra processed? And does it matter how much is in it? If it has 2% of that thing in it, is that ultra processed? What should the threshold be there? Should the way that the food is made affect the definition? Should they even call it ultra processed, or should they call it something else? And should nutrition facts be considered as part of the definition as well? In addition to that, they also have one very big question that I'm sure is going to matter a great deal to those of you watching this video, and that is, what considerations should be taken into account in incorporating this classification in food and nutrition policies and programs? That is a very fancy and verbose way of saying, how should this definition impact SNAP benefits? Because that's really what they're asking here is, how are we going to take this definition and apply it to what people can and can't buy with EBT? And that's why I think it's important that you should weigh in and make your voice heard, because ultimately it's those of you who are on EBT who are going to be impacted by this definition. I don't think that they are going to succeed in changing the American diet so radically that we see a lot of these products just ultimately disappear from the stores. Those who can buy them with cash will continue to do so. It's going to be the people who rely on the federal assistance that are going to lose their access to some of the foods that they like the most. And for those of you who love to jump in here and tell me that, well, taxpayers shouldn't be paying for soda or whatever, we've had viewers over the years raise legitimate questions like, well, what if I'm diabetic and I need something to raise my sugar quickly? Or what if my child is autistic and has sensory processing disorders and will only eat like these three foods? There are legitimate reasons, including, disability. What if you can't cook and prepare fresh food on your own and you need, a frozen meal or whatever to be able to feed yourself safely? There are circumstances where there is merit in having those extra options available to you. I think that's one of the reasons why we still see the restaurant meals program in use in some states, which, if you haven't heard of it already, that is the rule that lets people buy meals at, McDonald's even with their SNAP benefits because they have no other option for safely feeding themselves. So we are seeing a lot of those extra benefits that are built into SNAP starting to close. And of course, at this time, none of this has been finalized except for the state waivers in those states that I mentioned earlier. Those, have timelines and they're moving forward. But at the federal level, this is still just a discussion and you still have time to make your voice heard. So I would encourage you to reach out at the Federal Register and express your thoughts and hopefully have some influence on the way that that policy is going to go. Of course, in the meantime, I would encourage you to check out our sponsor, Ibotta, because they make it easy to get cash back on your EBT purchases. You just use the app, pick your deals, scan your receipt when you're done, and then you can get cash back to spend on other essentials that EBT doesn't necessarily cover. Go check that out, and don't forget to check out our other videos for more ways that you can save money and get free stuff. I'll see you there.